Welcome to Navigating the Healthcare System, Insurance and Privacy. Health insurance can be overwhelming, but it is important to understand your coverage because healthcare is expensive. Insurance is a plan you can purchase that will help you cover your medical healthcare costs. Insurance does not cover all costs, but it can significantly reduce what you have to pay out of your own pocket. In this module, we are going to discuss the different types of insurance, how to understand coverage information on an insurance card, and how providers handle your private information. Information sheets, resources, and additional activities from this module will be available from your instructor for you to take home and practice. These are the main topics we'll be covering in this session. In order to increase your health insurance literacy, we need to start with the basics of insurance. If you broke your arm and had to go to the emergency room, it would cost a lot of money for you to see the provider, get x-rays, and get casted. Without insurance, this ER trip could cost around $5,000. With insurance, the cost could be lowered to around $600, a $4,400 difference. Before we go over the different types of insurance, you're going to test how much you already know. Some hints. Some of the words are used more than once, and question 5 has 2 possible answers. Each of you will be able to score your own work as we move through the next set of slides. Pause the video here to do the workbook activity. Health insurance is similar to paying for your monthly gym membership or cell phone plan. You pay every month, even if you don't use it. It's important to note not all insurances are the same, and a procedure covered by one insurance plan might not be covered by another. This is why it's important to know what your insurance plan covers. There are many different types of insurance. The type of insurance someone has depends on how they get it. If your insurance comes from a parent or guardian's job, it's known as private insurance. Most insurance plans allow you to be on a parent or guardian's policy until you're 26 years old, even if you don't go to college, you get married, you live somewhere else, or if you get a job that provides health insurance. If you do not have insurance, you may qualify for government insurance, often referred to as Medicaid. There is no cost to apply, and depending on income and family size, you may qualify for free or low-cost health care. In Wisconsin, the Medicaid program is called Badger Care Plus. Badger Care Plus is managed by Forward Health, which is what you would see on an insurance card. We will take a look at insurance cards later on in this module. The Affordable Care Act marketplace is where individuals and families can compare insurance coverage, get answers to questions about insurance, and enroll in an insurance plan. If you or your parents do not get insurance through an employer, and you do not qualify for government insurance or Medicaid, then you can purchase it through the Insurance Exchange website for Wisconsin. If you do not have insurance, be sure to share this information with your parents or guardians. Covering Wisconsin is a tool for consumers to help them identify their insurance needs and purchase insurance of their choice. In order to start the application process, you must go to the website menu and click Enroll. You will need to enter basic information such as birth dates and social security numbers of those applying, information about any current health coverage, and family income. After entering this information, you will see the options available to you. If you are eligible for Medicaid, the results from the Covering Wisconsin website will include a link to the HealthCare.gov website where you can apply. Unfortunately, you cannot just apply for insurance through the exchange at any time during the year. You must wait for the open enrollment period to sign up or make any changes to the plan you currently have. Each year, you must re-enroll in an insurance plan no matter what type of insurance you have, private or government. This time period is called open enrollment. During this period, you can also change the plan you pay for. It is important to know when the open enrollment period is for your insurance because it is different for everyone. If you don't like your insurance coverage and you want to change it, you have to wait for the open enrollment period. However, if you have a life-changing event during the year before the next open enrollment period, you can change your insurance. Life-changing events are things like getting a new job, getting married, or getting divorced. You can work with a navigator to determine the best insurance plan for you. So, what is a navigator? A navigator is a certified health insurance expert that works year-round to help you find, sign up, and use health insurance for free. They help you look at different insurance plans and find the best deals for the marketplace, also called Obamacare or HealthCare.gov. Sign up for Badger Care Plus or Medicaid. Find information for financial help. Understand insurance and assist with complex cases, billing questions, and appeals. An insurance plan covers your medical costs. In the broken arm example, our medical insurance helped pay for the emergency room trip. But if the ER provider decided to prescribe medication to help you manage the pain, a prescription plan would help you pay for it. Prescription insurance works similarly to medical insurance. It allows you to get medications at a much lower cost. The pain medication prescribed by the ER provider could cost $80, but if you have a prescription plan, you may be able to get the same medication for only $15. Many times, an insurance plan will include prescription coverage for both generic and brand-name drugs you get from the pharmacy. A premium is a monthly payment to your insurance company for your healthcare policy. Your out-of-pocket costs are not included in your monthly premium. An out-of-pocket cost is the amount you must pay during the year in addition to your premium. This includes any deductible, copay, or co-insurance. Health insurance and prescription insurance have their own set of terminology to indicate your financial responsibilities for healthcare and medications. Take a few minutes to answer questions number 7 through 12 in the Health Insurance Vocabulary Matching activity. We'll go back and check your answers after we watch a short video that explains key health insurance terms.
So, what exactly is health insurance? It's an agreement between you or your employer and your insurance company to protect you from the unexpected, like getting sick or having to go to the hospital when you're hurt. When you buy or enroll in a health plan, the insurance company agrees to pay part of your medical bills for covered services. That's called coverage. It can cover doctor or hospital visits, prescription drugs, tests, and other healthcare services, including your routine preventive and wellness care. You pay a monthly bill, called a premium, for coverage. You'll pay part of the cost when you need medical care, and the insurance company pays part. What you pay is in the form of things like a copay, deductible, and coinsurance. A copay is a fixed amount you pay directly to the doctor, hospital, or other provider for medical services when you receive the service. A deductible is how much you have to pay out of your pocket before your insurance kicks in to start paying their part. Usually, the higher the deductible, the lower the monthly premium. And coinsurance is the part or percentage of medical costs you pay once you meet your deductible. For example, if the amount you owed is $100 and you have 20% coinsurance, you'd pay $20 and insurance would pick up the rest.
Once you have an insurance plan, you will receive an insurance card that acts as proof that you have insurance. Usually, when you receive any type of medical services, you will need to show your card so they can verify your plan and charge you the correct amount for the services. Your card will include basic information about your plan. Take a look at the example card in your workbook. If you pay for your insurance, your name, number 1, will be on your card. If you are on a parent or guardian's insurance, you might see their name on your card. That is because they pay for it. The member, number 2, and group, number 3, numbers are a way for the insurance company to know what kind of plan you have, where you get your insurance, and how you pay your bill. You may also find the name of your plan, number 4, copay information, number 5, and prescription information marked by the symbol RX, number 6. Insurance cards include a lot of information about your coverage, and they are your proof you have insurance for provider visits and medications. It is important to understand what you are looking at because not all cards are exactly the same. You need to keep your card or cards with you at all times in a safe place, along with any other relevant medical information, such as allergies, medications, and other health issues that are important to your care. During your visit, You will be sharing a lot of information with your provider. It is important to be open and honest with them about your lifestyle. If you would be more comfortable talking to your provider without your parents or guardians, you can ask them to wait outside the exam room starting when you are 12. Even if you are under 18, you can talk to the provider and get birth control, get tested for STDs, and get tested and treated for pregnancy without a parent or guardian's permission. The provider cannot tell anyone what you talked about, unless they are concerned about your safety or the safety of others, or you give them permission to share. Legally, your parents or legal guardians have access to your medical records until you turn 18. Besides being able to access your medical records, if you use a parent or guardian's insurance when you visit the provider, or to get any tests or screenings done, your parent or guardian may find out about it if the insurance company sends out an explanation of benefits, usually called an EOB. This helps explain what services were used, how much the insurance company will pay, and how much you are responsible for. If your parent or guardian gets this, they will know what services and/or tests you had when you went to the provider. Be sure to have a conversation with your parents or guardians before you go to your appointment about why you want to speak with the provider alone. You can let them know you are learning how to be a self-advocate in school and that you would like to try it out on your own. It is important to be honest with your parents or guardians about your health concerns, too. Insurance can be a very overwhelming topic, especially since there are so many different types of insurance and so many different guidelines to follow. But with the high costs of healthcare, it is extremely important to have an insurance plan to help cover some of those costs. If you take the time to learn about your insurance options and pick the plan that is best for you, you will be able to make responsible decisions regarding your medical care.